Hey guys, I'm LaKrista with Unscripted, where we're breaking the system, finding root causes, and exposing the lies you've been prescribed. Let's jump in.
I think, Krista, I would like to ask you why would you, so we're Republic Pain Specialists, Bryan, Texas. Maybe we should introduce ourselves a little bit. I'm David Gaskin, owner, founder of Republic Pain. Been in business for 2019, but I'm more interested in you, right? Tell us your background and why you came to Republic today.
So I'm a registered nurse. I was diagnosed with autoimmune diseases in my mid-20s. And then whenever I got pregnant with my daughter, had to come off all my medication, got really sick, and just realized that I just wasn't getting better. And that's how I really ended up in the holistic realm, was just figuring out how to heal myself. Muscle testing or applied kinesiology healed me when I was 17 from it, probably nervous system stuff. Every time I'd not even just stand up, sit up, I would pass out. So they had me in the hospital for like 3 days running all kinds of tests. A muscle tester actually found that we had a gas leak in our house, and so I had or have MTHFR mutation. So I was the only person in the house that was sick, so I wasn't able to detox and get it out of my system. So it was just building up. I found that out actually later, that why I was the only one that was affected. So she's the one that found that, and then again when I was 27, ended up in the hands of another muscle tester who, basically healed my lupus and RA. Don't have any issues with that anymore. And so that's when I was like, I need to do this. There's no one in our area. And so I went and did the initial training and continued to do training because I was just fascinated by it. And so that's what I do now. We do applied kinesiology is the main modality, but you know this, as you fix somebody that has one thing, the next person you get is more sick than the first one. And so just progressively, so now we see people with everything, we see a lot of people with cancer too. So we do IV ozone and high dose vitamin C IVs and peptides and all of that. So it's went from a small practice in my sunroom to now we have 2 locations. So that's really how I got into the holistic realm. And I think God always gives us the biggest challenges with ourselves and with our family, because then we, whatever your calling is, that's going to be your hurdle. So with me, I've never been able to, for the last 2 years since I've been having these issues, I've done everything for, my nervous system. And we kind of talked about that a little bit, but I had kind of like a traumatic event that just completely disrupted my nervous system. And now, since that happened, even though it's over, there's no threat to me anymore, mentally, emotionally, physically. When I wake up in the morning, I sweat.
How long was that? Do you mind me asking?
2 years ago is when it started. So when I wake up in the morning, my heart races. I wear a blood sugar monitor. My blood sugar spikes when I wake up. Sometimes it's only 20 points, sometimes it's 40 points. So like dawn phenomenon. So everybody's goes up a little bit, but mine just skyrockets before I even get out of bed. My heart rate will go up 140, 150. I'll sweat, I get nauseous, I get a headache. And so it's very hard for me to get up. And really the only thing that I can do is, usually I just roll over on my stomach and just lay there. Usually if I don't have to get up, I'll just lay there for 30, 45 minutes. Yeah. Now, if I have to get up, as soon as I get vertical, it's gone in 2 or 3 minutes. It doesn't last that long. But I'm almost in just from the books that I've read, it seems like I'm in almost like a theta brain state. So it's kind of half awake, half asleep. So I can't convince myself, just stand up, just get up and it will go away. But I'm in this, I can't do anything. And so it's I've done everything, like we talked about on the phone, cold plunging and vagus nerve, somatic work, emotion code, trauma release, all this stuff. And my nervous system just will not reset.
To accept it, huh?
Yeah, and so that's the only time it bothers me, just when I go from sleep to trying to wake up. Now, if I sleep in and just sleep, and my alarm doesn't go off and I sleep as long as I need to, I'll sleep like 9 or 10 hours, and it doesn't happen.
Oh, really?
So I don't normally have that if I wake up on my own. But if something wakes me up, it's, especially if I haven't had a lot of sleep, it's worse.
More
So,
tired or fatigued. Do you find during the day you're more fatigued?
I don't have any issue really with being tired.
Okay.
Even with lack of sleep, I'm usually fine through the day. Like
Okay.
I maintain my energy pretty well. So yeah, I don't know. Then I had a client that went to you for, she lost her smell from COVID. And then the more I started looking into it, I was like, this is like a nervous system reset. I was like, this is probably what I need. And I haven't had a sense of smell for 10 years now. But obviously COVID, well, the COVID that we know wasn't around then. The only thing I can think of when I lost it was we were remodeling a house, and I know there was mold in there. We were ripping out carpet. It was old house, pulling paneling down off the walls, and I got like a really bad smell in my nose. Like I thought there was something dead in the house. I was like, did an animal crawl in a wall and die? Like, this is awful. It smelled like something dying. And that went on for, I think it was about a week. It might have been longer, but I went to our local pharmacy, and he was like, just take high doses of zinc. You know, the pharmacist was like, just take a lot of zinc. So I did that. It didn't help. So I went to an ENT, and he was like, oh yeah, you just need to take zinc. And I was like, I already did that. And he said, well, then you'll probably not be able to smell again. Your olfactory nerves are probably burn up. It was probably just a virus or something. And I was like, that's it? And he was like, that's it. I was like, well, that's depressing.
Yeah.
So now, like, if you throw clothes in the washer, and then you do something, and then you come back like the next morning, and I'm like, oh no. My kids just know, since they were like 10 or 11, I'll call them down and be like, hey, I need you to smell these clothes. Do they need to be, I can't even tell, anything. It's just, you don't realize how much you use your smell.
Yeah.
Now, taste, I don't feel like is really as affected. I do feel like I probably over-season my food, so it's probably affected a little bit, because if I'm cooking, and sometimes my kids will be like, oh, that's a little too, you put a little too much on there. But so now I just don't usually season anything until like I put it on my plate, so I know it's probably affected a little bit, but I can still taste things. But that's really the main things. I don't have anything that's like major or debilitating. It's just like, well, I guess, the waking up in the morning it's like, I like to get up early, go to the gym, get a lot of things done. And I've got 4 kids, so like, especially with little ones, you want to get up in the morning, get things done before they get up, and it's really hard for me to do that.
Yeah.
And so I feel like I need that to go away so I can get back on track.
I get it. Any other, I printed these out for us, for you, but what we consider dysautonomias, dysautonomia is just a malfunctioning autonomic nervous system. That autonomic controls all your body functions, sleep, rest, hormones, sweating, heart rate, blood pressure, all those things, kind of what you're describing. Sometimes we'll see like virtually every body system impacted, or we have some shortness of breath. That's just not us, we're normal, totally athletic, healthy, and yet I walk 2 flights of stairs and I'm kind of can't catch my breath, Okay. I'm not really exerting myself, and yet my heart rate goes to 140, unprovoked. There's no really reason for it. That dizziness with standing is, the cardiac is not talking to the vascular system and coordinating and keeping the blood pressure at the right level. So all kinds of little things like that. GI disturbances, IBS, irritable bowel. More severe cases would be Crohn's, ulcerative colitis, things like in that order.
Have you heard of the Morph device? So when you said IBS, it's a little device, and hopefully at the beginning of the year, I think insurance will start covering them. But they're about this big, and they go in. There's acupuncture points on the ear, and they just tape it behind the ear, and they wear it for a week or so. And it's for pain and like GI issues in kids are really the main reasons that they're using it. It's just like neuropathy, pain, and they wear it, and I'm assuming it's doing something with the nervous system.
I'm guessing without knowing more about it. I'm guessing it's a vagus nerve stimulation. Auricular vagus nerve is one of the closest places we can get to the vagus. There's vagus. You can reach the vagus in the neck here. But the whole problem in dysautonomia is to explain why would we do that, right? So the gut IBS, the gut issues, are predominantly covered by the parasympathetic system or the vagus nerve, right? There's only 4 nerves that encompass the parasympathetic nervous system: cranial nerve 3, 7, 9, and 10. 10 is the vagus, and it is one of the largest nerves in the body, so it's a lot. But so the GI tract is innervated by the vagus and predominantly the parasympathetic system. We call parasympathetic rest and digest. So if the vagus is not working properly, if it's kind of shut down, it's just not functioning, then we'll see GI symptoms. We'll either see constipations, we'll see diarrheas, and more of the higher inflammatory autoimmune stuff. Then we'll start seeing, the Crohn's, the ulcerative colitis, instances like that. So then the question becomes, I think, is I'm always thinking, why? Why would the vagus not be working properly? Have you ever thought of that?
I mean, I know in my case, like I said, traumatic events and things like that, and a lot of times I don't really know what else would trigger it besides just our stressful lifestyle.
You're totally exactly there. You just mentioned 2 of them: a traumatic event in your past, or a stressful lifestyle ongoing. But both of those are sympathetics influences. You see what I mean? Mm-hmm. So the traumatic, post-traumatic stresses, things like that's happened in our past that we're kind of stuck in. A chronic, ongoing, daily stressful environment. Police officers, EMS workers, I think nurses. COVID was just horrible for a lot of my nursing friends. So it was really traumatic to them and stressful every day to walk in and watch so many people die. But all of those instances are sympathetic fight or flight responses, right? Stress / sympathetic. They're synonymous. So it's creating increased blood pressure, increased vasoconstriction, increased heart rate, releasing more epinephrine so we don't sleep, we have insomnia. So those are all the opposites of rest and digest. Why would we, because of those things, this is what so many people don't understand, the relationship between sympathetic and parasympathetic, is that those 2 systems work in a reflex to each other. So it's a reflective response. If sympathetic is elevated, your parasympathetic system, or that vagus innervation to the gut, does not stay, say, at baseline. If we've got a graph and we're starting at zeros, and sympathetic and parasympathetic are supposed to be fluctuating in, some days moments we're higher in sympathetic, and then it gets nighttime and I'm tired and it's time to sleep, and then I move more into parasympathetic activation of the body. But you can't keep parasympathetic stagnant if sympathetic goes higher. So
inverse relationship.
They're an inverse. Yeah. They work opposites to each other. I describe it as a balancing act, like a teeter-totter, right? If sympathetic goes up, the opposite parasympathetic has to go equally down. But if parasympathetic goes up, then sympathetic will shut off also. So these 2 work equally, but in opposites of each other. And it's a reflective mechanism of the body that's happening totally outside of your willful control. That's why it's called the autonomic or automatic nervous system. It's working. You can't control it. You can't, well, we could talk about that, of how do we have any conscious control of this autonomic system. There's certainly some things we can be doing, and people do it subconsciously. They know it helps them, but they don't understand why. But so when we're in an overactivated sympathetic state, we will see gut issues, and people will go, but that's the vagus. I go, I know. But it's because of the overactivated sympathetic state that your gut's not working, that the parasympathetic is essentially turned off or dialed down. I don't know that they're ever completely off. I've described them as like volume dials on a big stereo. You can turn that dial up or turn it down, but it never goes completely off. The body's always in a dominance of sympathetic because that's the protective mode of the body, the fight or flight system. You're always going to be in a dominant sympathetic tone to protect you and keep you comfortable and safe, whatever that is. But when we stay in that overactivated sympathetic state too long, the body develops, and a doctor, I hope I'm not wrong here, but I believe it was Dr. Tracy back in the 70s described set points, meaning that the nervous system will develop set points of where it thinks you should live. What is your normal operating set points in this relationship between sympathetic and parasympathetic? My belief, I haven't talked to Dr. Tracy. He wrote this in the 70s, so I don't even know if he's still alive. I hope he is. I hope he is. If he ever hears this, maybe he'd reach out to me. But he wrote this in the early 70s, and I think they were seeing, coming back from Vietnam, a lot of vets and a lot of post-traumatic stresses. And even if we were born genetically with a pretty balanced system, you send somebody into a life-threatening environment for months, years at a time, they come back with PTSD because their body now believes that they should live in this higher sympathetic tone. Now they're in an imbalanced state between sympathetic, parasympathetic, and we see all the symptoms of that, of insomnia, brain fog, confusion, headaches, GI, shortness of breath, tachycardias, you see what I mean? Sexual dysfunction, all the things here that, guess what? Light sensitivity, dry eyes, mouth, nausea, diarrhea, difficulty urinating, dizziness, fatigue, fainting, orthostatic intolerance.
I just saw the difficulty sweating. That's really interesting. I have an infrared sauna, and if I don't get in the sauna, like if I'm working out at the gym, like even running, I just very rarely, I don't sweat a whole lot without getting in a sauna and like forcing my body to sweat. And I feel like I've been that way for a really long time. So,
I mean, you could very well have some genetic component there.
Yeah.
It's not, it may not always be environment that's produced, this state, but, and when we start using, I actually caution people when I'm using the word dysautonomia. Most physicians would classify that as POTS, right? Postural orthostatic tachycardia syndrome. Dizziness with standing, tilt table test. There's certain, little tests that we could diagnose you with POTS, and then that would be a true dysautonomia. I think, in my opinion, is just to use my opinion, is there has to be some continuum of a dysautonomia, because that dysautonomia is such a broad, big umbrella term that really describes every body system, every cellular level, every hormone, everything. Yeah. If you don't have POTS, could you not have, if you don't sweat and you have these racing hearts and you have dizziness with standing and insomnias and gut issues, does that mean you don't have a form or a milder form of dysautonomia?
Yeah.
I think that's exactly what's happening. So you can't just, I think we can't just put it in a box of, okay, if I don't have POTS, then we can't call it dysautonomia. I think there's different degrees of dysautonomias.
So is the main thing that you see people for the stellate ganglion block typically lack of taste and smell, or is it more on the pain side?
It's evolved over the years. You
treat them for
being
one thing,
prior military,
all these other things go away.
I was in the military for a long time, and my son was special ops, special forces, and so I did anesthesia and nerve blocks for 25 years. So I was doing stellates for our military buddies for a long time, and so for PTSD, it was really what I kind of cut my teeth on the stellate for. Basically just for people we knew and friends that needed help in some really bad times. When I came into and started doing the pain practice and moved into pain, obviously it kind of opened up, and I used it more for pain syndromes, complex regional pain syndromes, and some really severe anxieties and depressions. So we were using it for that, and still had my PTSD patients that would come in and still needed help. And in 2021, we started seeing this thing called long COVID come around. A doctor in Alaska, Dr. Luke Liu, Liu, published a case study on 2 patients that he treated their long COVID symptoms, smell and taste disorders, and lots of other symptoms, okay, and with a Stellate, and followed them for, I believe, 6 months, and all their symptoms were alleviated, over that 6-month time. I had a friend that had long COVID and was very comfortable with the Stellate, and offered it to him, and he couldn't, get it fast enough. He wanted it done. It reversed his smell and taste disorder in minutes. And that really started the realm. I give him credit for getting onto some social medias and telling people that there was something that helped him. People started coming and jumped forward 4 years and about 4,000 patients, and we've seen. I've been able to publish on it twice. So I've seen a lot of people for smell and taste disorders. What I would like people to know, and in our second publication was exactly this, is that people would come because of this parosmia, this distorted smell and taste that was from a COVID infection. And yet COVID had been around 2 or 3 years, right? 4 years now. But they would give me this history when I take their history that, yeah, I've had IBS for 10 years, or I've had insomnia for this year. I was diagnosed with PTSD when I was in my 20s.
All the other stuff goes away with it.
Right. I had Crohn's, or I had ulcerative colitis, or I had fibromyalgia, or I had, chronic fatigue. Guess what? They're all listing all of these autoimmune diseases. That's been around for 20, 30, sometimes 40, 50 years for them. I was just taking their history. I definitely was not treating autoimmune disease, and yet we would do a Stellate, bilaterals, to treat their smell and taste, and then when we checked on them a couple of weeks later, they'd go, but all my fibro's gone.
That's crazy.
All my rheumatoid pain
So why
is
do you
gone.
do both sides? Is there ever a time where you only do one?
Not anymore.
Okay. Yeah.
Years ago when we were treating PTSD, the vast majority of research says the right side is the dominant for post-traumatic stress, anxieties, things like
Okay.
that. And yet a Dr. Mulvaney in Annapolis, I believe he's ex-Navy SEAL, has published many, many times on PTSD. He found out that some PTSD patients don't respond to the right. And that's basically what we were taught, is that you only do rights for post-traumatic stress. He found out and published on it that a certain percentage of people will respond to the left. And so and Dr. Liu, when he published on the long COVID, he did a right and a left. And that was one of the first times I'd ever read a bilaterals, a right and a left, stellates. I'd never heard of that before. But I started doing them because of those 2 reports and those publications. And so we started finding the same thing over several thousand patients now. Most people will respond to a right-sided block, probably 80-85%. But those that don't respond to the right will probably respond to the left.
So explain the procedure a little bit. And when you're doing both sides, are you still going into the same location?
Same location.
Okay.
Yeah.
Okay.
The autonomic nervous system, sympathetic, parasympathetic. Your sympathetic system begins at the coccyx, at your tailbone, with one little ganglion, which is a cluster of nerves, okay? And it splits at the coccyx and runs on each side of your spine, ultimately to terminate in the right and left hypothalamus of the brain, okay? Exactly the same place our fear centers are, right? The limbic system, okay? So the fear center is more specific to the amygdala, but within amygdala is a part of the hypothalamus. Okay, so these ganglion run on each side of the spine. In the sacrum, lumbar, and thoracic, there's essentially one ganglion per vertebral level on each side up. So you have a little ganglion, you have a little nerve that moves up to the next ganglion, and that keeps going. So it looks like a little chain of grapes when you dissect the bodies out. So we call it the sympathetic chain for that reason. It kind of resembles a chain of these ganglion. Something very interestingly, I like talking about this, is changes when we get to the cervical spine into the neck. You have, 12 thoracic, 5 lumbar, 4 to 5 sacral. When you have a ganglion at each of those, when you get to the neck where there's 7 vertebrae, we only have 3 ganglion. Something changes. Something changes a lot, okay, in the cervical spine. In lumbar, sacral, thoracic, we have what we call input and output signals. The sympathetic chain is taking information in from chemicals, pH levels, blood pressures, temperatures, right? All this signals are going into the sympathetic chain, sending it to the brain. But now we actually have almost immediate efferent signals going out telling the body what to do about that. It's fixing it right away, right? If your blood pressure is too low, it'll constrict or increase heart rate, yada, yada, yada. Temperature, you'll start sweating, or you'll shiver if you're cold. You're right, all these different things. Hormone releases. It's happening very, very quickly, except when you get to the cervical. When you get to the cervical, now we only have 3 ganglion, a superior, middle, and inferior. Your stellate is the inferior ganglion, the lower ganglion. It's predominantly afferent signals are sending signals to the brain. There's only a few efferent signaling happening, mainly going to cardiac, going to our heart. There's very little output signals in the 3 ganglion in the neck. I just think that's, I don't know, when I get to heaven someday, I'm going to ask.
Why?
Why? Well, there's something very different. Now we only have 3 for 7. And it's predominantly afferent sending signals to the brain, primarily. There's still some efferent signals, but not like the rest of the sympathetic chain. So when we block or just do a local anesthetic injection on that sympathetic nerve, it stops the flow to the brain, or at least to half of it, to one side. And this is where theory comes in, okay? This is where the theory comes in. How could it possibly help you? How could it possibly help with sweating and insomnia and tachycardias and POTS and, pain, inflammation, rheumatoid, fibromyalgias, all these unusual autoimmune things? How could it possibly help that? We think the theory is that when we stop your sympathetic input to the brain, fast and quick, I think it's got it. That's a key to me. It has to be hard and fast. I have to shut it off.
Turn it off, yeah.
You got to turn it off. If you do that, because it's the protective mechanism of your body, totally innate, you have no conscious control of it. Another key concept there. The central nervous system, the brain, has to get that system up and running again. It cannot allow that system to lay dormant or inactive for any length of time. As a protective mode of the body. And so it does some sort of reset of that system, some sort of reboot, some sort of
It's like
through auto
unplugging something and plugging it back in.
It's turning your phone off and turning it back on. And maybe that's way too simple an analogy. I'm sure some neuroscientist is going to, call me out for, like.
But I mean, essentially that's what's happening. Just resetting it.
It has to.
Yeah.
It has to. When the first guy I treated, Keith Wright, I'll tell his name. I'll give him total credit for the smell and taste stuff. Keith, in 5 minutes, he had all his smell and taste back.
That is crazy.
He's 5 years out, and he's still 100%.
That's what I was going to ask. So, how long? So, you said it can last forever, as far as.
Keith apparently is.
But when the actual injection, the actual block that you go in and do, how long does that?
I use lidocaine,
So
which
when
is
it's
the
gone, it's
shortest local anesthetic, shortest acting local anesthetic that we have. The half-life is 15 to 20 minutes.
Okay.
So within 30 minutes, 45 minutes, it's completely eliminated from your body and gone.
So a friend of mine got to looking it up on TikTok and freaked herself out, you know. And she said a girl got paralyzed. And she goes, it was only temporary, but still. And I guess it was maybe someone hit the wrong spot with the lidocaine, I guess. And I said, well, it's only temporary. It's fine. If it gets rid of everything, I'll be paralyzed for 20 minutes. That's fine.
You're not going to be paralyzed. No. I would not say the stellate ganglion block by any means is an injection someone should do without proper training. It's not for your average anesthesia provider, whether that be CRNA or even an anesthesiologist. This should be probably done. I think it should be done through a fellowship-trained pain management provider. So whether that be CRNAs or whether it be anesthesiologists, or there's lots of pain management people that are interventional radiologists or primary cares, or a lot of different physicians, PM&Rs. So, but they need to be properly trained in this injection. In the neck, there's a lot of vasculature there. There's other nerves there. Your brachial plexus is very close. It's a lot. I think it should only be done with ultrasound. That's a key thing. If we're using fluoroscopy let me talk about that for a second. You realize this is not new.
How long has this been around? You said the 70s?
No, since the first publication on the stellate ganglion block was 1925.
Really?
Yeah, it's been around 100 years.
That's crazy. And
I just looked it up before we came in. There have been, what did I just tell you? 837 publications on the stellate ganglion block.
It's crazy to me that, like, all the stories you hear about, it's literally automatic, like instant, what happens, and nobody knows about it. Like, everybody I ask, I'm like, I'm going to get a stellate ganglion block. They're like, what is that? I'm like, I didn't know either, but it's crazy.
I know. It saddens me, being in the military, my son, all the veterans that we've treated. All the publications we have on the stellate for post-traumatic stress. How many suicides we're losing,
The government should give this, like, annually to people in the military. I think, or if needed, you know what I mean? Or once, and then forever, as often as they need it, because...
Every VA hospital should be offering it free. Just walk in. You can get one anytime.
Yeah.
I use 7 cc's of lidocaine. 7 cc's of lidocaine can change someone's life.
Yeah.
It's pennies, right? And a properly trained person, I've done well over 4,000 injections between the PTSDs and the long COVIDs, well over 4,000 injections. I've never had the first complication, and I'm going to always knock on wood. But to me, it's such a safe injection. And we know that 100 years, 837 publications, we know the risk profile of this injection. It's been around 100 years. We know if it were killing people, right, it would be all over the literature. It would be known, don't do that injection. It's not. It's a very safe injection. We've used it for 100 years for everything from hot flashes from menopause to autoimmune disease, to PTSDs, anxieties, depressions, ulcerative colitis. It just goes on and on. There's a list of 30 things that it's...
That's what I was going to say when you were talking about the hypothalamus. Forever. We know that controls a lot of the hormones and stuff. So do you see this changing women that have like difficulty regulating their hormones and things like that once they have this?
I don't want to talk about my staff too much, but my staff, a lot of females. One of them came to me a couple of years ago. We were doing all this. She's young. She's like in her early 30s, maybe late 20s. I don't want to get in trouble.
Yeah, always guess lower.
Guess low. So okay, we're gonna say 25.
Yeah, okay.
But she came to me. We were seeing these dramatic responses doing stellates, and she said, "I have horrible menstrual cycles." She goes, "They go at least 2 weeks. Horrible cramping pain before, horrible cramping pain after." She goes, "Do you think a stellate would help me?" And again, it was one of those things. I go, "I don't know." I said, "I don't think so." I said, "But the hormonal system is regulated through the autonomic system. Could it be that you have some autonomic dysfunction?" I mean, man, that's a real stretch, but if you're willing to try it, let's do it. She came back crying the next morning. She goes, my period stopped. She goes, it stopped.
Crazy.
We follow to this day. She has a 5-day cycle. It stops at 5 days. Then every female in the office wanted it. Okay, and
they're lined up when you come in, just waiting.
Everybody's menstrual cycles it gets regulated to 5 days on and off.
Now,
it's
if
like
they
a
all
switch.
get synced up, you're gonna have to take a week off.
I know. I just take that week off every month.
So I have a client who she actually just came in yesterday, and I told her, I was like, I can't. Like, you are the most difficult. Like, her she can't get her hormones regulated. Like, and she's done every kind of pellets, testosterone cream, testosterone injections, and it's like everything will be good for a while, and then like the numbers will shoot up, and then she'll have to come off of it. Then they bottom out, and then it's just like it's all over the place. And when you said hypothalamus, her name came in my head. I was like, I wonder if it's just, if there's something there. Again, it's a stretch, but
I don't know. When we're saying it's a stretch, how many hundreds of thousands of people do you have to see to go, I don't think it's a stretch anymore?
I think we just live in the way that we live is not how our bodies were designed to. We do way too much all the time. We're chronically stressed out.
Yes,
and
absolutely.
It just affects everything. Everybody has high cortisol and until it bottoms out because they've been stressed for too long.
Adrenal fatigue. It's just exhausted. Yeah. The body can't produce it anymore. And when you start thinking about that, like, who should not get a stellate? Right? When you start looking at, I tell this story. My little grandson was over at the house months ago, maybe a year ago. He's curled up with me in my recliner. He's watching Bluey, and I go, trying to be grandpa, trying to be, encourage him or trying to, I go, hey, bud, I said, what are you going to do to change the world? What do you think you're going to do? I said, you're going to cure cancer? Or you're going to go to Mars? I said, I just think you're going to change the world. And this is a kid that talks a lot, so he's real quiet. He doesn't answer me. He's kind of curled up, and he's not answering me. And he goes, he didn't answer for a long time. And I finally go, dude, you awake?
Did you fall asleep on me?
Yeah. And he goes, Pops, I just want to watch Bluey. I don't know if I can do that.
That's a lot. I just want to watch Bluey.
Right. So when you talk about this environment that we live in today, I think I'm a loving grandpa. I'm putting pressure on an 8-year-old kid
to go to Mars.
To change the world just by the things I say. In middle school, they're all having to take AP classes, right? We're telling them you got to be in AP classes, you got to be Excel, you got to be top 10, you got to do this, you got to do that. You got to go to college, right? You got to have a college degree. You got to make straight A's. You got to do this. Then you got to get married. Then you got to make $1 million. You got to be hyper successful, right? All the things. It never seems to stop. The stress, either we're putting on ourselves or society is putting on us to say we got to be thin. We got to be beautiful. We got to be. I just think it's running rampant through our society today. Probably worse for females, right? Y'all got to be thin. You got to be beautiful. You got to do the Botox. You got to go to the gym. You got to you got to be mom. You got to be a successful career. I actually think it's a little easier on us guys. We just kind of show up to work and come home, and
I always say, who's the woman that decided women's rights and we needed to work outside the home? They messed it up for everybody. I should have I would have been happier just at home.
I had a young girl come in the other day that severe anxieties, POTS symptoms, and she had a friend with her, and they're both in a graduate program in a university close by. And we started talking about this. I said, think about all the universities that have safe spaces for all their students to go I call it hide in. You know, if something triggers them, something upsets them, something really makes them anxious, then they can go to a quiet place to get away from it and let their body calm down. That's nothing more than an overactivated sympathetic state that the body can't control. They can't, and we're trying to get them reduce the stimuli so that their body can calm down. I asked these two girls, 25, 26 years old, I said, how many of your college classmates are on anti-anxiety medicines?
Almost all of them.
And that's what they said.
Almost
they
all
said
of them.
Every one of them.
When my daughter, she started having, it wasn't really POTS. We were thinking maybe it was anxiety that she wasn't really aware of. Her heart rate would go up and stay there for a long time. And her head started feeling really heavy. We got her to the chiropractor, and the chiropractor did some craniosacral work, and she was fine. It went away. And it was severe enough we had been to the ER because I was like, you need a cardiac workup, because it's either going to show that there is something and we can address it, or it's going to show you there is nothing and you can calm down. And because then once it started, then it was like a cycle, because she thought she had something wrong with her heart, and then we couldn't get her out of it. One trip to the chiropractor. You know, I mean, she was like, there's a nerve pinched, and then your nervous system can't operate like it's supposed to. And it's just crazy, because the first thing that, whenever I said she has insurance through her husband's work, and I said, just see if they can do telemedicine. You know, they looked up. I said, just do a call with them and see. They threw Zoloft at her. And I was like, they did zero investigating. Like, she's 21, and you just, all of a sudden, your heart rate's skyrocketing, and they're just, take some Zoloft? Like, is that what it is now? It's crazy.
It really is sad that the medical profession today is, if we can't operate on it and excise it, then we're going to drug it.
Yeah.
Right. And they're only treating symptoms.
Yeah.
Right? If you go and you have POTS and insomnias and tachycardias, you know, you have dysautonomia, and you go, and I've had people that came in and they were accurately diagnosed with dysautonomia. And so they would put them on a beta blocker to slow their heart rate. They'd put them on Ambien to make sure they could sleep at night. They'd put them on an antidepressant, anti-anxiety med. They would tell them to drink more water, you know, for their POTS.
Well, what you're doing, they're not lifelong patients anymore.
No.
You fix them. So there's no money in it for long term.
God, I hope that's not not how we're treating is based off what money it generates, you know, over time. But there's my fear that that's true.
Yeah,
okay.
I definitely think there's.
So, now, I got to back up just a little bit too. I don't want anybody listening to this, if they hear this and think that I'm promoting that, you know, the stellate ganglion block is you know, you have a little anxiety and you're not happy, or you know, that you get a stellate ganglion block right away. There are so many things, more conservative, holistic things, that if we would implement them during the day in our daily lives, we can correct this way before you have to come get a needle put in your neck by me. I do Wim Hof. I do breathing and cold work every day to regulate my autonomic system, train my autonomic system. I think yogas, breathing techniques, deep breathing techniques, you know, red light therapy, saunas, chiropractors. I think all of those things, acupuncture, there are so many methods and modalities that people could start implementing daily that they would see improvements in their body. There are going to be a percentage of patients that those, what I call self-helps, won't reach. And then it's, again, that continuum, that degrees, there's varying degrees. In the early stages, I think those self-help things can correct it and it can modulate it and keep it under control, and they'll be fine. If it goes too long and we start seeing those lupus and RAs and fibros and, you know, POTS symptoms, what I've found is that those self-helps, they make them feel better, but they can't get rid of all their symptoms, and they need that reset.
If you miss a day or two, it's right back.
Yeah. Or even if for a few minutes, you know. So they feel better for a few minutes. Exercise, proper diet, all those things are super important. There's, like anything, there's going to be a percentage of patients that need the next level, that need the next step. the Stellate is a safe. It's just a safe option for people that doesn't involve a drug. We've been doing it a long time. We know what it does, what the safety profile is. I just wish more people knew about it, and they could get that they'd understand that it's out there. It's been out there for a long time. I've talked to psychiatrists, psychologists that have never heard of it. I'm like, how do you go through your entire doctoral degree and no one teach you about something that's been around 100 years for what you're
For PTSD and anxiety.
for post-traumatic stress, anxieties, depressions? What? How is that possible? There's something definitely wrong in the training process of our physicians that they're not even told about it. There's not one lecture on it. You haven't heard about it. You know, so there's an issue there. And maybe this is something, you know, when you reached out to me and said, hey, can we? I think I'd like to talk about this. Ask me questions. I think I can talk. You know, and I don't want to promote to anybody that I'm not a physician. I'm a CRNA. I am board certified in pain management and board certified in anesthesia, so I'm dual board certified. But I'm not going to try to be an expert at anything other than telling people what we see on a daily basis in thousands of patients. And where will this go? That's the cool thing. That's the cool thing is sometimes you got to do some things. Maybe something good did come out of COVID in that thousands of patients came to a little clinic in Texas. We were willing to do something and try something that I was familiar with and confident with. And almost as a secondary effect, we're seeing all these crazy responses. Postmenopausal hot flashes disappear. Diabetic neuropathies in feet disappear. Fibromyalgia from 50 years. Fibromyalgia, 50 years erased, gone with one injection.
It's crazy.
I mean, you would have to say, and people are going to say, that's crazy, David. You're a used car salesman. You're a snake oil salesman. And I'm saying that's fine. You say what you want, but you can't deny what keeps happening. And if you doubt it, just come watch it.
Yeah.
Okay.
Yeah,
And
I'm excited.
So it's a good thing. It's something that the world needs to recognize and use more of. And the publications are out there. It's in the literature. It's been used for so many things. Some of us in the medical field just won't try anything unless it's in the literature, right? You know, we kind of stand on that, on the science, you know. And well, guess what? This has it. It's there. 837 publications. Okay. All you have to do is look and read. Okay.
What's the craziest story or craziest thing you've seen when doing one of these?
I know what it is, but you're gonna make me cry if I talk about it. Okay. Hillary. Hillary came to me. I'm clinical faculty for some pain fellowships in America. Hillary came to me as a fellow. She was a pain fellow, and she followed me for a couple of weeks. And as most of the fellows that follow me do, she saw these stellates and saw these crazy things that were happening. And most of the fellows asked for me to do a stellate for them. And I think some of them are just, they're just curious.
You don't want to do it to somebody else if you've never had it
right,
done yourself.
Right, you know, like I want to experience it. I want to kind of know. Almost all of us have something, you know, whether it's pain or past traumas or something that, you know, that's not great, not perfect. That's the normal, that we're not perfect. And so Hillary asked for a stellate. And because she's a doctorate prepared nurse and in a fellowship, I didn't get too deep into her, like, why she wanted the stellate. She was perfectly healthy, yada yada. So we went through that, but I didn't dig into her psychological history. Like,
I mean, she'd been watching it.
I probably should have now. Okay, now and
you do now.
I do now. So we did a right stellate for Hillary, and she had a huge emotional response. And some people will get that. They'll cry. basically uncontrollably for anywhere from 15 minutes to 30 minutes, something like that. My wife will laugh hysterically for about 15 minutes. She can't stop laughing. So it's making some connections. It's resetting the brain. It's bringing some areas of the brain into play that have been shut down kind of through a protective mode for a long time. Won't let us go there. Won't let us use that part of our brain. So Hillary starts crying uncontrollably. And it went on and on and on. 40, 45 minutes. I mean, we had people just sitting with her, holding her hand, telling her she's okay, she's good. After about 45 minutes, I go in and I sat with her and I said, hey, you want to talk about it? I said, that was a really intense response. I said, do you want to talk? Is you okay? You know? And she was very open, and she said it was my childhood day. She goes, my mother was selling me for sex when I was 5 years old. And she said, it wasn't my dad, it was my mother. And it was, she goes, as soon as you did the injection, she goes, my eyes were closed, but she goes, I went back and I was standing at the driveway of our trailer house. It was a mobile home trailer. She called it white trash. I don't want to. She said we were total poor, white trash. And she says, I'm standing at the driveway looking at our home when I was a child. And she says, little Hillary comes out of the trailer, meaning her, at 5. And she says, little Hillary comes down and she's ragged and dirty and no shoes. And she says she walks to the end of the driveway and she reaches out and takes my hand and starts leading me back to the house. And she said when I got about halfway there, I kind of hesitated. I didn't want to go back in that house. And she said, little Hillary turns to her and says, it's okay. She goes, you don't have to be afraid anymore. And she tugs on her and takes her farther. And they get to the little porch, the steps, she says. And she gets to the steps. And little Hillary, this is her word, says, little Hillary stops and looks up at her again and says, I have to go in, but you have to go on. She said, it's time for you to let go. And she said, little Hillary let go of her hand and walked in the house. And she said she woke up. But that had been 45 minutes of uncontrollably crying.
Did she remember that? Like, did she?
She remembered it all. Yeah, it was. She said it was crystal clear. She says, I just relived that.
But before the stellate, had she blocked it out?
No.
She
still
knew it.
She had
vivid memories.
Her mother had passed away several years ago. She still couldn't speak with her dad. She blamed her father for allowing that all to happen over the years. She had eating disorders. She had anxiety attacks, bipolar. Gosh. She had everything, just like you would expect, due to those traumas. And she said, she goes, David, she goes, and I kind of felt horrible. Like, oh my God, you had to relive that. I didn't know if that was really bad or good. And she said, no, David, she goes, that was the most cleansing, cathartic moments of my life. She goes, I've been waiting for that my entire life. And I was like, wow, okay, cool. Well, guess what? A couple hours later, it's time to do her left.
And you're like, oh no.
No, I've never seen it do it twice. I've seen those big emotional responses, but when you get the big emotion on the first time, they typically won't have that response. We've already made that connection.
Right.
It's already, It's already turned the right stuff on. It's already made the connection in the brain. And so I told Hill, I said, don't worry. The left side, it's not going to do this. Don't worry about it. You're not going to cry for 45 minutes. I've never seen that. It's going to be okay. I'll be damned she did it again. She did it again, and I mean, it might have been worse.
Oh my gosh.
It just went on and on and on. It was, I was like, oh my God, I can't believe it.
I hope I laugh like your wife.
Guess what? Finished that, 45 minutes later, jumped to the end. I go, okay, Hill, what the hell? What was it this time? And she said, I met my mother.
What? Oh my gosh.
She said, I met my mother. She goes, Mom came out of the house and came down to me and met me in the driveway. And she says, we looked at each other. And she says, for the first time, I wasn't angry and bitter like I had all my life. She goes, I looked at her and I thought, what must have happened to her that she did this to me?
It's generational, yeah.
The generational traumas. Mm-hmm. And she goes, it dawned on me, what had she gone through? What was it that made her do that?
Yeah, then she felt sorry for her.
And she felt sorry. And she looked at her mother and she said, I'm sorry. I forgive you. And her mom nodded and they hugged and she walked back in the house. And Hillary woke up.
That's crazy.
So Hillary texted me a month after that and said, I've changed my birth date to August 7th. I'll never forget it. She goes, it was August 7th of 2025. She goes, I have a new birth date. I will celebrate August 7th.
That's awesome. I love that.
So Hillary gets the... I've seen some cool stuff. I've seen some really cool stuff, but I think Hillary gets the
that's the top one
the
right
top
there.
one.
Yeah.
She is so, and she's that. I saw her.
Is she doing these on other people now?
She's done a pain fellowship, but sadly she lives in California, which is pretty restricting. But
I've had clients actually move out of California because it's bad.
She wants to, but I saw her at a conference months later, and she said she is still 100%. So when I tell people it's a reset of your nervous system, there's no way that 15-minute block of the nerve could produce years, months, weeks,
mm-hmm.
months, years of symptom relief if it were not resetting that autonomic system.
Yeah.
It's doing something so special.
I'm ready.
LaKrista, it's really
I'm excited.
Really cool.
That's what this morning Mitchell was like, are you like nervous? I'm like, no, like I'm pumped. Like I'm so ready. I'm like, put the needle and let's go.
Yeah.
Like, yeah.
Well, I'm curious about that. Do you need to know anything about the stellate? Do you need to know, are you afraid of, is it going to hurt? What will I experience afterwards? Anything like that?
No, I mean, I think we kind of covered it. I'm either going to laugh or cry.
Or nothing.
Or
I mean,
nothing.
Not everybody does. Not everybody does. So.
Yeah. But yeah, I mean, if you're using lidocaine, I mean, is there any pain involved with it usually?
We will do a little cold spray on the skin, basically so you don't even feel me poke you with the needle. There'll be a pressure sensation as we're injecting, and you kind of feel the pressure sensation. But I think it's uncomfortable. To be honest, I think it falls under uncomfortable, weird. I don't think it's painful.
Just different. Yeah,
different. You've never experienced it before, most likely. So people just say that was weird, but not that it, oh my God, that hurt so much.
Yeah.
The expected side effects is the droopy eye, constricted pupil, warm, flushed skin, congestion in the sinuses. All of those are signs. It's called Horner syndrome, that evidence that we blocked sympathetic. If we block the actual sympathetic innervation to the head, face, upper arm, then we leave parasympathetic unopposed. So all of those signs that you're seeing, the droopy eyelid, constricted pupil, vasodilation, are all the unopposed parasympathetic innervation to the face, head, and neck. So that just tells us we did a good block. Again, because I use lidocaine, that's gone in 20 minutes, 20, 30 minutes at most. So don't be alarmed by that. You can get a feeling of a lump in your throat. Some people do, some people don't. You could get a little hoarseness if we get a little runoff onto the recurrent laryngeal nerves that supply the vocal cords. That's why we won't do them simultaneously. Okay, so people should know that. When we say we're doing bilateral stellates, we're not doing them at the same time. We're going to break them up several hours apart on the same day, but several hours apart. I need to make sure this block is gone, completely eliminated, and there's no risk of, and I'm really just worried about your vocal cords. If you have a flaccid vocal cord on one side and I block the other and it's flaccid, now you can't open your vocal cords to move air and you need to be intubated. So we don't want to do that.
Yeah,
okay?
Let's not do that.
So we're not going to do that. So as long as we know one block is gone, a couple hours later, we can do your left side. Regardless of what response you get from the right, you're going to get a better response when we do bilaterals. It's something about, I'm not quite sure. Of all the ones I've done, I'm not sure, is it that it's left, that you're a left dominant, a right dominant, or is it that we shut that system down twice within a few hours and let the system reboot again? Something, but the bilaterals on the same day just work better than even if I did your right side today and brought you back next week and did your left side. It still works.
Need to be close together.
Yeah, there's something that really improves it. Okay, so it's kind of become our protocol. We do a right and left on the same day, usually morning and afternoon. Lidocaine is a big deal. It needs to be hard and fast. The longer acting local anesthetics, ropivacaines, bupivacaines, take 3-4 minutes to set up, create the nerve block. I tell people, if you give the world's greatest supercomputer, your brain, 3 minutes to adapt to a turnoff, shutdown, it will adapt. Yeah. It will protect itself. Lidocaine hits in seconds. Lidocaine shuts that off in seconds, and I think the lidocaine is a big deal.
No time to
my
adapt,
experience after hundreds and hundreds and hundreds of both, using both, lidocaine works better. Lidocaine works much better than Marcaine, ropivacaine. You must do it with ultrasound. I just would not, and I'm probably going to get eviscerated by the old pain guys that have been doing this for 40 years, that have done it under X-ray, under fluoroscopy, and they've never hurt anybody, and I'm sure they have good outcomes, but I can point out, and we will, okay, I think we're going to film your injection, okay?
Yeah.
I will point out the various vasculature that is there, that is very close to where our needle goes. And when you're doing it with X-ray, you can only see bone. You cannot see any nerves. You can't see any vasculature. You can't see muscles. So you're very inaccurate with it. And it's a high probability you're going to get into a vessel and inject intravascularly with it. So that's where some of the risks come in. So I think properly trained people with an ultrasound guided is where we're able to do thousands of injections without the first complication, not a bruise. Okay, so lidocaine's big. Ultrasound is mandatory. I'm going to say mandatory. Yeah. Okay, and I think the last thing is you're going to get 2 injections today, on one side, 2 on the other. There, of those 3 ganglion that we talked about in the neck that I talked about, 20% of the people don't even have a stellate ganglion. Dr. Mulvaney figured that out doing cadaver studies in the military. 20%, they did this cadaver study, and 20% of the cadavers did not even have the stellate ganglion at the C6, C7 level. It had fused lower into the first and second thoracic ganglion. So when we were doing stellates at the lower inferior ganglion, about 20% of the people would not respond and get a good response. Dr. Mulvaney in Annapolis started blocking at that middle ganglion and the inferior ganglion in the assumption that 20% are not going to have the stellate. Let's block the middle ganglion also and see what happens. And something like 97% of those people responded.
Nice.
So I adopted that years ago. So I block at the middle ganglion and the inferior ganglion. And on the assumption that you might be one of those 20%ers, I'm kind of doubling down. I'm going to make sure you get that quick, hard, sympathetic shut off, and then we're going to let God decide whether he wants to reset your nervous system, okay?
All right, sounds good.
All right. You ready to do it?
Let's go do it.
All right, let's do it.